Let's look at a couple of cases of fat necrosis. So both of these cases are from patients who've had breast surgery. One was a breast reduction and one was a surgery for cancer. And this is typical of what you see. So this is really degenerate looking fat. Notice it's got a weird staining text quality to it. Sometimes you get sort of yellow staining as well, and it's kind of lost its definition. So it's hard to see distinct adipocytes. Not many cells around. This is a little group of them, and these are foamy macrophages. Notice there's a bit of nuclear enlargement in them, and the cytoplasm is relatively abundant, so a low NC ratio, and they're just kind of scattered around here, maybe in little loose groups in places. And some of the nuclei are sort of largish. This is the pap stain on the same case. And again, you can notice like the fat, fibroadipose, is staining strangely here, and it's not very well defined, so it's breaking down. Here are the same foamy macrophages. Sometimes you can see quite prominent nucleoli in these, I can't in these particularly, and these are really lipophages, so they're ingesting all of the lipid broken down fatty material from the necrotic breast fat. Often these cases are accompanied with a suspicious or some degree of suspicion on radiology because they can form a hard irregular mass. Notice the foamy cytoplasm here. And if you see these cells and they're quite active, so prominent nucleoli, large nuclei, and groups of cells, they can be a little suspicious. Notice how these are really intimately associated with this broken down fat. So they're actively in there kind of gobbling up the fatty tissue that's undergoing necrosis. This is the other case. We've got maybe slightly better preserved fibroadipose there, and then these little clusters of macrophages. Nuclei are sort of slightly largish in them, but fairly uniform. And notice that foamy cytoplasm again. Pap stain. This actually has like a clump of quite active looking macrophages in the middle of the fat here. You can see there's some nucleoli present in them. And this is the sort of case that can be a little tricky and sometimes overinterpreted in company with suspicious clinical findings. Here's a multinucleate one, and that's often seen as well. So in summary, fat necrosis is usually characterized by clumps of degenerate fibroadipose tissue, sometimes really just a sort of pale imitation of it really. There's usually very few, or if any, epithelial cells present, but quite a lot of lipophages around, and you can see multinucleate histiocytes as well, and those macrophages have very foamy cytoplasm usually. There's usually a history of trauma, like a motor vehicle accident, some injury to the breast, or more commonly probably surgery, which was the case with both of these.